Having high blood pressure is a dangerous risk. Maybe you or a loved one has a high blood pressure level. It is crucial to understand what is this condition and the underlying threats or risks it may pose. Blood pressure is a measurement of the pressure exerted by the blood flow on the arterial walls. It is often stated as a ratio between the systolic blood pressure, which measures blood pressure at its greatest point during heartbeats, and the diastolic blood pressure, which measures blood pressure at its lowest point between heartbeats. A millimeter of mercury, or mmHg, is used to measure it. A normal blood pressure reading is 120/80 or less. If it's greater than 120/80, you run the danger of developing hypertension, also known as high blood pressure. This is a silent killer. About 108 million adult US citizens are affected by this illness according to the CDC. Only roughly 1 in 4 people with the illness genuinely have it under control, and it has no obvious symptoms. In fact, it can even be deadly. Those with a blood pressure of 180/120 or more have an 80% probability of passing away within a year, and their median survival time is just 10 months. Let's discuss the main reasons why having high blood pressure poses a concern. Before we continue though, a brief request from us. If you find value in this video, please don't forget to subscribe and hit the notification bell so that you don't miss our valuable content on health in the future. Now off to our discussion on high blood pressure. For the majority of individuals, high blood pressure has no known cause. Primary or essential hypertension is a form of high blood pressure that often develops gradually over several years. Some individuals have elevated blood pressure as a result of an underlying ailment. Secondary hypertension is a form of high blood pressure that typically develops unexpectedly and raises blood pressure more than primary hypertension does. Secondary hypertension can be caused by a number of medical illnesses and drugs, including kidney disease, adrenal gland tumors, thyroid issues, obstructive sleep apnea, some congenital blood vessel anomalies, and some medications. As you become older, your chances of having high blood pressure rises. High blood pressure is more prevalent in men up to age 64. After the age of 65, women are more prone to have high blood pressure as well. The heart continuously pumps 5 liters of blood throughout the body of an adult. The heart contracts, creating pressure that pushes blood through a system of about 160,000 kilometers of veins. Blood pressure that is 120/80 is regarded as normal. However, blood pressure is regarded as increased or high if either the systolic blood pressure or the diastolic blood pressure is above 80 and the risk of adverse health impacts rises. There are several classifications for blood pressure. Systolic blood pressure of 120/129 and diastolic blood pressure of less than 80 are considered to be elevated blood pressure. High blood pressure is present if the reading is more than 130/80. A hypertensive crisis occurs when blood pressure values are 180/120 or above. When this happens, it's quite risky. For lengthy periods of time, high blood pressure causes 2 detrimental changes in the body. First, our blood arteries become more resilient to withstand the added pressure exerted on their walls. And second, the heart has to work harder to pump blood throughout the body, 2 really important items that cause several bodily issues. We'll discuss each of these developments, beginning with blood vessels. Our body strengthens the blood vessels to make up for the stress brought on by hypertension so that they can withstand the elevated pressure. The blood vessels thicken as a result, which makes sense, doesn't it? Atherosclerosis, or the hardening of arteries, is a result of this. Plaque, a hard material that develops as a result of atherosclerosis, sometimes stays undetected until it ruptures or gets severe enough to obstruct the arteries that carry blood. Our blood arteries do not have much room for plaque to build up. Our largest artery, the aorta, has a diameter of around 25 millimeters. The diameter of tiny arteries and arterioles, however, is between 0.01 and 1 millimeter. Additionally, the capillaries have a diameter of 8 to 10 microns, which is just 7.5 to 8.5 microns larger than a red blood cell. Another effect of operating under high blood pressure all the time is that our blood vessels weaken and are more prone to bursting. An aneurysm is a bag of blood that can form as a result of such ruptures. A hemorrhage occurs if this blood bag ruptures. Hemorrhages and plaque ruptures both have the potential to have negative health effects. They can result in a stroke if they happen in the brain. They can cause renal damage or even kidney failure if they happen in the kidneys. They can cause retinopathy and possibly visual loss in the eyes. As if any of those things weren't awful enough, they can also result in dysfunctional sexual behavior. And that's how blood vessels are affected. Now, we move on to how hypertension affects the heart. The heart pumps around 7,500 liters of blood throughout the body each day at a typical heart rate of 60 to 100 beats per minute. In a lifetime, that equates to more than 200 million liters of blood. But when blood pressure is high, the heart experiences a condition, left ventricular hypertrophy, or simply put, a stronger left ventricle. Now, this isn't a desirable development since a stronger left ventricle would require more oxygen. However, no new blood vessels are developed during hypertrophy to make up for the size gain. As a result, some muscles suffer from oxygen deprivation because oxygen cannot be transported to the appropriate locations in the heart at the appropriate periods. This results in a heart attack, or a myocardial infarction, or possibly cardiac failure if the left ventricle is unable to produce enough blood pressure. So when we have high blood pressure, this is what may occur in our bodies. Clearly, hypertension can result in a number of very significant issues. So let's discuss the root reasons for high blood pressure and possible solutions. Primary hypertension, which has no known cause, includes a number of risk factors including heredity, age, excess weight, a high salt diet, drinking, and smoking. A combination of these causes in the list may be blamed for around 90% of all cases of hypertension. Also to note is that inactive people typically have greater heart rates. The greater the stress on your arteries and the harder your heart must work with each contraction, the higher your heart rate. Being overweight is also more likely when you don't exercise. Additionally, secondary hypertension exists, which has an underlying etiology. Diabetes, polycystic kidney disease, renovascular hypertension, Cushing syndrome, and adrenal and thyroid issues, among other conditions, can cause this. As you can see, there are several factors that contribute to hypertension. Sadly, there is no cure for high blood pressure, only treatments. But there are several changes that people can make to reduce the risk of hypertension, and many people see results rather quickly if the following tasks are done efficiently. The first change is creating a healthy diet plan. The next one is quitting smoking or avoiding smoking at all possible cost. And the last change is to reduce or limit alcohol consumption. Now, some of our videos on this channel cover these different topics. If you want to find out more, check out our other videos on this channel. That concludes our video on the topic of high blood pressure and their risks, as well as the best ways to reduce these risks. Be reminded that this video is primarily for information, and we do not claim to provide medical advice that is tailor-suited to your needs. Be reminded to consult with a medical professional and seek personalized healthcare that will fit you. Additionally, leave a like, subscribe, and click the bell button to receive information on our new health-related videos. If you want to watch more of our content, check out this video in the lower right corner. You can also check out our playlist of related content. If you have tips or advice that will reduce high blood pressure, post them in the comment section below. I would be glad to read them. Anyway, see you later, and thank you for watching.